So for people with diabetes, we know that there are basically three things that if you take care of these three things, you can prevent most all the bad things that are going to happen. So it's controlling blood sugar, it's controlling blood pressure, and blood cholesterol. Those three. And if you can get those to the goals, where we've already shown that if you get to those goals, your chance of developing, illness related to diabetes goes way, way down. So now, what percent of people with diabetes do you think have those three things under control?
10%.
Yeah, about 10%. Meaning that 90% are not. And that, to me, for people with diabetes, that's the fundamental question. So we're fortunate that in the science of diabetes care, we figured out what we can do to prevent these bad things from happening. That's not true for a lot of diseases. We know what you need to do, but it's not happening. So why is that? Well, it's not that patients are bad, and it's not that doctors are bad. It's that the system of care, getting back to what I was talking about, the acute care system versus the chronic care system, the system of care is really not the way it should be designed. So, the kinds of things that we know are helpful to help people get there is a number of things. So one, I talked about making sure people don't fall between the cracks, using computers to track individuals, to identify, to make sure that they get all the care that they need. And we've got computers that can do that. Computers are great to remember things and remind things and all that. So that's one piece of it. But also, how do you change behavior? And there are a number of researchers here at Penn State that are very interested in how do you, so just giving somebody a plan of here's how you should eat and here's how often you can exercise, how well do you think that works? Some people grab it right away and they go, that's it, I'm going to do it and that's it for the rest of my life. But for most people it doesn't. And it's really how you discuss it with them and how you engage them and what support you give them along the way to continue to follow what you're suggesting that is more likely to do it. An example would be engaging, it's this idea of directing people what to do. People tend not to like directions, to be told what to do. I have a 15-year-old, so I can speak from experience. But if you negotiate with them and guide them, they're much more likely. So here are the kinds of things that would be helpful for you to do. What do you think you feel comfortable trying to work on today? What should we talk about? Let them choose the agenda. Let them choose what they're willing to do. And let them solve the problems. So what barriers do you think there might be if you decide to do this? Let's talk about them now. Let's try to solve those problems. That kind of approach, it just intuitively makes so much more sense, but is not the typical approach that most providers do. And so we've been very interested in teaching providers how to do that. We teach our medical students now, through all 4 years of medical school, how to counsel people in that way. And the idea will be not only to just have the doctors do this, but other people in the office, and really to have the whole healthcare team helping people to take care of themselves. Because a lot of this comes down to self-management. It's how people live their lives and take care of themselves. And that is the single biggest reason for people dying in the world today. It's how they take care of themselves.